Hello, my name is Dr. Boom. In today's video, we're going to talk about a case of a young patient presenting with fatigue and heart murmur. So this patient is a 25-year-old male who does not have any significant past medical history, who plays sports mostly on weekends. So he has a job, he works his job from Monday to Friday, and on weekends he likes to kind of rest and play some sport. And then he started to complain of some fatigue, which started a few months ago. And the fatigue, it seems that it's getting a little bit worse. He said there was no chest pains, there was no palpitations or feeling of irregular heartbeats. But he has this significant history of sudden cardiac death in his family. So he went to his doctor, and on examination, the doctor found that he has a murmur, which is mostly on the left side at the sternal part of the chest, which decreases with hand grip, and when he squat, the murmur tends to decrease as well. And then when the doctor asked him to strain, or what we call like a Valsalva maneuver, the murmur seems to be increasing. So based on this history and the findings on his examinations, the doctor has formulated one of the differential diagnoses. And the doctor thought that this is highly suspicious for hypertrophic cardiomyopathy. Now, hypertrophic cardiomyopathy, as I will explain, the heart is divided into four chambers. And the left side of the heart, which is the left ventricle, which mostly receives the blood, and the blood which will be pumped out to be distributed to the vital organs of the body. And that part of the heart is noted to be thickened. And with that thickness, it is hard for the heart to pump out blood, and that part of the heart becomes stiff. So this hypertrophic cardiomyopathy is autosomal dominant, meaning that those who inherited the dominant gene will manifest the disease. So the genes, we get it from our parents. So half from our dad and half from our mom. So if the half is dominant, that tends to manifest itself. So this is one of those diseases which manifests if there is a dominant gene in the trait. So these types of patient, most of them will be asymptomatic for years, so they will not feel anything. They think that they're really doing well. And we heard about some stories of mostly athletes who just for some reason died while doing their practice or while playing the game. So this patient has been referred to a cardiologist, and one of the first step is to do an EKG to see the rhythm of the heart, if there are some suggestions of some thickening of the heart muscles. And the EKG on this particular patient showed suggestion of left ventricular hypertrophy. And the cardiologist will order for some echo to see the structures of the heart and to measure the heart muscles, and the echo confirmed the diagnosis. Now, he was eventually diagnosed with this hypertrophic cardiomyopathy, and the treatment is to avoid this strenuous activity, and this patient was started on a beta blocker. Now, this treatment aims to slow down the heart rate so that there is enough time for that left ventricle, which is the part of the heart which has a thickened muscle, to fill up with blood before the heart receives the signal for the heart to squeeze the blood out to distribute it to the vital organs. And in some cases, these patients will present with irregular heart rhythm, which mostly lead to death. And in these cases, some patients may need a pacemaker um, uh, to regulate the rhythm, basically. And in some really extreme cases, these patients will need surgery to kind of shave that thickened muscle off. So for my last take, this is very important. One should be screened for this particular disease, for hypertrophic cardiomyopathy, if the patient has a family history of sudden cardiac death. And those patients will need to be screened before they get accepted to participate in school activities. Also, those patients who presents with fatigue, chest pain, special exertion, shortness of breath, palpitations, or the sensation that their heart was racing, or history of passing out. So this is very important because usually this hypertrophic cardiomyopathy is a silent disease, and sometimes it manifests suddenly, and sometimes the outcome is catastrophic. So it's very important to be aware of your family history, your presentation, and as I said, you need to discuss your health concerns with your doctor. So this is the end of the video. This is a very short video, and I hope that you learned something. And thank you so much, and God bless. And I hope to see you in my last video. Thank you.